Welcome back to our part 3 and our conclusion to our discussion on jaw pain, or TMJ, if you are familiar with the term. I'm Taylor Mikesell. I'm a physical therapist here at Innovative Physical Therapy, and this is...
Hi, I'm Haley.
So what I want to talk about in the last part of this is other things that can occur and that can happen because of your jaw issues. And some of the things that we have noticed, and two of the more common things that people have told us is not only is their jaw bothering them, but they also get headaches, right? Especially on the same side as the jaw issue. So if you have a hard time chewing on one side of your mouth and you happen to get headaches that radiate around the same side, they can be related to each other, as well as the relationship that you have between your jaw and your head and neck. It can also lead to neck pain. So people that are having neck pain can also be suffering. The jaw pain can be what is causing your neck pain as well. I think if you are someone that likes to get massages and you're always tight and you're always tense, but you have this lingering jaw pain, and the massages help your neck pain at first, but then it comes back, then the jaw pain may be contributing to your neck pain. So if you have any questions, or if any of this sounds like you and you're suffering from this jaw pain and you're unable to eat the foods you want to eat, and every time you go out to dinner you have to make a decision based on what foods you're able to eat, and you can't always get the foods you want, like a nice juicy steak, or what's your favorite food?
Pizza.
Or pizza. You can't get a good pizza because you're having the jaw pain. Then I would advise you to sign up for a free discovery visit today and come talk to one of our experts in person, one-on-one, so that we can get to the bottom and the root of your problem and get you on a path that leads to better health for you and a better life. We can't wait to work with you, and we look forward to seeing you.